Hello everybody, thank you for coming to my presentation today. My name's Amanda, I'm a postdoctoral fellow at the Peterborough Center for Addictions Research and the Doggett Center for Medicinal Cannabis Research at McMaster University. Thank you so much to the RSMj organizers for letting me send in this talk pre-recorded. I am really sad that I couldn't be there with you all today to see you in person, but I'm nonetheless excited to share our work with you. So the paper that I'm going to talk about today talks about cannabis attitudes and perceptions since Canadian cannabis legalization. Now the work that I'm going to present today is already published, so if you're interested in some of the more finite details of this work, you can find those at the QR code on your screen. A little bit of background, just very briefly. As I'm sure you're all aware, a key concern before and throughout legalization has been this concept of normalization. That if cannabis use becomes more socially acceptable, more normalized, that could in turn lead to increased use and potentially misuse in the population. Now, the US has pretty diligently tracked cannabis behaviors as well as attitudes and perceptions over time. Over the last several decades, and they found that social acceptability has gone up and risk evaluation has gone down. Now, unfortunately in Canada, we don't have data that's quite as robust, and in fact, whether we're talking about cannabis use behaviors or cannabis attitudes, a lot of the data that we rely on is cross-sectional in nature. Now, this is just a brief interlude to talk about what I'm not going to talk about in the presentation, which is behavior change. So if you are interested in how individuals' behaviors changed over legalization, like their cannabis use frequency or their misuse, this is where I shamelessly brag about the fact that our lab has actually done a bunch of this work. So if you'd like to learn a little bit about behavior change since legalization, I encourage you to check out some of the works that I've put up on the screen. Starting at the top, this was the most recent work that we did where we did a natural experiment type control group analysis looking at emerging adult trends over legalization. And we've also looked at this in general community adults. We've looked at cannabis expenditures and then more general trend patterns in emerging adults as well. So again, all this to say, if you're interested in behavior change over legalization in Canada, please check out some of our papers. So for this particular paper, the methods that we use, this was from the PathCann Prospective Cohort Study, which you might have already heard about today in some of the presentations by a few of my colleagues. But just briefly, PathCann is a prospective cohort study that started just before legalization in September 2018. And is still ongoing, but the data that I'm going to talk about today is only up to October of 2023. So we have 11 time points in total every 6 months is when they were evaluated. They were general community adults recruited from Hamilton at baseline and who were 18 to 65. And the measures that I'm going to focus on today, as I alluded to, are the measures related to perceptions and opinions, so social acceptability of recreational and medical cannabis use, as well as perceptions that surround cannabis safety, so safety of consumption, how addictive cannabis is, and the different risks and benefits that could be related to cannabis. The analytical approach that we took was to look at ordinal generalized linear mixed models for almost all our outcomes. We did this in a Bayesian imputation framework, which is just a fancy way of saying that missing data, which happens in almost every prospective cohort study, was handled under a missing at random framework, so we're not as concerned about any systematic biases that can happen due to missing data. Now, normally this is where I would transition to telling you a little bit about the demographics of our sample, but because I want to spend the bulk of my time talking about the results of this paper, and because this paper is already published, I've included the QR code again on this screen, so if you're interested in kind of sample demographics, I encourage you to check out the full paper, but I'm going to actually kind of transition right into talking about what our outcomes looked like. So first, starting just descriptively, what was the landscape of social acceptability? So the top line there, that teal line, just shows you over time the percentage of people in our sample who said that medical cannabis use was socially acceptable. And you can see that at almost all time points, that's over 90%. The pink line underneath that is ratings of alcohol use being socially acceptable. And you can see that that hovers between 80 and 90% at all our time points. And then underneath that, the yellow line, that's recreational cannabis use. So between 65 and 75% over time was the rating of people saying, yes, recreational cannabis use is socially acceptable. Transitioning to safety, so we measured a lot of different safety outcomes. I'm going to highlight just two on this graph. The first one is the purple line, which is people saying cannabis is not addictive. So the percentage of people who said cannabis is not addictive, you can see on this graph, did decline over time, started about 25% and never really got back to that by October 2023. And then in the light blue, which almost overlaps with the purple line, that is ratings that cannabis consumption carries no risk. So that also started around 25% at baseline and declined over time. So jumping right into the model results, which were those generalized linear mixed models, which control for sex, age, ethnicity, and income, and look at the trends over time and whether or not the measures that we looked at either declined, increased, or didn't change. And what we found was that when we looked at the social acceptability measures, there was a significant increase in the acceptability of regular recreational cannabis use over time. There was also an increase in the acceptability of trying cannabis once or twice. And interestingly, there was a decline in the acceptability of medical cannabis use over time, which we were not necessarily expecting. And I'm going to talk about that more in a moment. One of the other things we tested in separate models were interaction terms. So we were interested to see whether or not people who used cannabis before legalization sort of changed their opinions differently than people who didn't. And we found that that was the case, but maybe not necessarily in the direction that we expected. So we found that people who didn't use cannabis pre-legalization were actually the ones that showed steeper likelihood towards greater acceptability. And it's possible that these folks just had more room to change their opinions, and people who used cannabis pre-legalization were already just kind of constantly rating it as acceptable. But this is an interesting finding nonetheless. Moving on to safety. So although social acceptability increased over time with the exception of medical cannabis use, this wasn't at the expense of safety perception. So we actually saw over time people increasingly thought cannabis was more addictive. We saw increasing concerns about cannabis worsening existing health problems or being detrimental to sleep. And we saw decreased beliefs that cannabis could help with depression and anxiety. And we thought that this could potentially relate or be connected to the declining social acceptability of medical cannabis use as well that we saw in the social acceptability findings. So we also tested interaction terms for these outcomes as well. And we found that people who used cannabis pre-legalization actually were the ones who showed steeper likelihood in being more skeptical. Essentially, so if they used cannabis pre-legalization, they were more kind of skeptical of the safety of cannabis over time. And this could be for a number of reasons. One reason that we hypothesized was that if you use cannabis pre-legalization and you had more exposure to it, you were more likely to either have experienced maybe some of these negative consequences yourself or know someone who had. So to give you kind of an overview of our top line findings, we saw increases in social acceptability since recreational legalization in Canada, with the exception of medical cannabis use. But there were not parallel changes in safety. So actually we saw more cautious safety evaluations and more thoughtful considerations of risk over time. In terms of how this compares to other data, this is consistent with existing data from the Canadian Cannabis Survey, which is like Canada's national cannabis survey that tracks cannabis attitudes and behaviors. And it is repeat cross-sectional in nature, but was consistent with our kind of prospective data that we had in this study. However, both of these studies are kind of in contrast to US research, which has showed steadily declining risk perceptions over time. What we thought was interesting was that at the same time period as our study was conducted, CCS, in addition to also looking at cannabis attitudes, they also looked at rates of people seeing cannabis-related public health messaging. And that actually declined over time. So 76% in 2018, which, as you recall, was the baseline for our study, down to 50% in 2023, which was the end time point of our study. So over the same time frame, it looks like cannabis public health messaging also declined, or at least people's rates of seeing it or recalling seeing it declined over time. So although they had more cautious safety evaluation, it doesn't appear to be the result of increased public health messaging. Now, just to talk about some of the strengths and limitations of the study, we had a number of limitations, the first one being that it's not representative of the Canadian population. This was a proposedly sampled prospective cohort study, which might limit the generalizability. We also, because it was prospective in nature, it can be difficult to disentangle whether people's opinions are shifting because of something in the external environment, like legalization, or because of maybe just changing their opinions as they get older. Now, we weren't, there's two kind of factors that mitigate this concern a little bit. One being the fact that our study findings were consistent with repeat cross-sectional data, which wouldn't have the same kind of issue. And then the other thing being that our age range was quite wide, like 18 to 65. So we were pretty confident we weren't seeing some sort of kind of developmental changes in opinions and perceptions either. The other limitation is that because we didn't have pre-legalization trends, enough data pre-legalization, we couldn't formally evaluate legalization as a driver of change. However, our study also has a number of strengths. The first one being that this, to our knowledge, was the first longitudinal exploration of cannabis changes in attitudes and perceptions since legalization in Canada. So we were really kind of lacking data in this area, especially prospective cohort data, and this study did fill that gap. Because of the longitudinal nature of the study, we could examine trends without being concerned about whatever findings we had being due to some sort of cohort effect. And although many prospective cohort studies suffer a lot from missing data, we did use a framework that robustly handled that, so we were less concerned about statistical biases. So I will wrap up there. Thank you so much for listening to this presentation. Thank you to the funders for making this study possible. This is normally the point where I say I'm happy to take any questions, and I am happy to take any questions. They will just have to be through email, which I've included on my screen. Thanks again for listening, and enjoy the rest of RSMJ.